Okay, imagine this. Your dog seems totally fine, then suddenly really struggling for breath.
Yeah.
You get them to the vet, they run some tests, and then you hear something completely unexpected. Like part of their lung is actually twisted on itself.
It's quite shocking when you first hear about it.
So today we're doing a deep dive into exactly that, a condition called lung lobe torsion in animals.
That's right. We've been digging into a pretty detailed medical text covering this. And our mission really is to unpack what this twisting actually is, who's most at risk,
Right.
how vets figure it out, and, critically, what the options are to help.
Okay, let's jump right in then. Lung lobe torsion. It sounds, well, serious. What is literally happening inside an animal's chest?
Okay, so think of the lungs not as just two big balloons, but made up of sections, right? Lobes.
Lobes, okay.
Torsion means one of these lobes twists around its base, the connecting point, called the hilus.
The hilus, got it.
And this hilus, it's like the main junction box. It's where the airway, the bronchus goes in, and where the blood vessels and lymphatic channels connect to that specific lobe.
Ah, okay.
So when it twists, it's like kinking a hose pipe. It squeezes shut, or at least severely narrows, the airway, the vein draining blood out, the lymphatics,
Oh, wow.
and eventually even the artery supplying blood in. It basically chokes off the lobe.
So everything gets blocked. Are certain lobes more likely to do this twisting act than others?
Generally speaking, yes. The right middle lung lobe tends to be the most common culprit, particularly in larger dogs.
Larger dogs, okay.
But, and this is really key, if you have a pug, they seem predisposed to it happening in the left cranial lobe, the front one on the left.
Huh. Specific to pugs. Interesting.
Yeah, and we do see it in other lobes too, sometimes even more than one lobe at the same time. And much less commonly, the twist can even happen partway through a lobe, not just at the base. They call that midlobar torsion.
Midlobar. Okay, so a twist within the lobe itself. Once that twist happens, what are the immediate effects on the lung tissue?
Well, first off, because the vein gets blocked easily, blood can't get out. So the lobe swells up, gets really engorged with blood, it gets bigger.
Right, like a dam bursting almost.
Sort of, yeah. And then as the blood supply continues to be compromised, the tissue isn't getting enough oxygen. It starts to die. That's called infarction.
Infarction, okay.
And if that progresses, you get necrosis, the tissue actually breaks down. This often causes bleeding into the chest cavity, what we call a hemorrhagic pleural effusion.
Bleeding inside the chest. That sounds bad.
It is, and sometimes, though less commonly, you might see chylothorax instead, which is where lymphatic fluid, kind of milky fluid, leaks into the chest.
Okay, so it's clearly a critical situation. What happens if somehow an animal gets through that initial phase without surgery? Are there, like, long-term consequences?
Well, it's less common to survive long-term without treatment, but in those chronic cases, yeah. The affected lobe tends to shrink down over time and become fibrotic, scarred, essentially.
So it becomes non-functional scar tissue.
Pretty much. That part of the lung just doesn't work anymore.
Okay, so let's talk risk factors. Who is most likely to experience this? Is it older animals, younger ones? Certain types?
It definitely affects dogs more often than cats. And there's a strong link with large breeds, especially those with deep chests. Dogs built like barrels almost.
Like Great Danes, Weimaraners.
Exactly, those kinds of breeds. But, and this is important, it doesn't only happen in big dogs. Smaller breeds can get it too.
Good to know.
We also see a specific connection with Afghan hounds, often when they also have that chylothorax condition we mentioned.
The milky fluid again?
Yeah, and age-wise. It really can happen at any age. But for pugs, that spontaneous kind we talked about, that tends to occur in younger ones, usually 4 years old or less.
Younger pugs.
Oh, and one other thing, it seems to be more common in male animals.
Males. Interesting. No clear reason why.
Not really definitively explained in the text, no. Just an observed prevalence.
Okay, so we've got large, deep-chested males, young pugs, maybe Afghan hounds. What signs should an owner be watching for? How would this actually look at home?
The signs can come on really fast and be quite dramatic, or sometimes they develop more slowly. The big one is difficulty breathing. So dyspnea, that's fast, often shallow breathing. Or just obvious respiratory distress, like they're really working hard to breathe. You might also see lethargy, just seeming really tired, weak.
At themselves.
Exactly. Anorexia, so not wanting to eat. Sometimes a fever. They might seem painful, maybe restless or protective of their chest area. Some dogs show orthopnea. They find it harder to breathe lying down, so they might prefer to sit up or stand with their elbows out.
Right, trying to make space.
Yeah. A cough is possible, and if you see any blood with the cough that's called hemoptysis, that's a definite emergency sign. Retching, like trying to vomit but nothing comes up, can happen too. Then things a vet might pick up include a dull sound if they tap on the lower chest, a really fast heart rate, pale gums, maybe even a bluish tinge to the gums or tongue.
Cyanosis, lack of oxygen.
Precisely. And in the worst cases, they can go into shock.
Wow, that's a serious list. And like you said, it can be sudden or creep up. What actually triggers this twisting? Do we know the causes?
That's one of the tricky parts. The exact cause isn't always clear. It can be quite inconsistent, but we do see associations.
Okay.
Things like previous chest trauma or having a tumor in the chest, neoplasia. And as we mentioned, chylothorax in dogs seems linked.
Right.
In cats, it sometimes seems connected to underlying conditions like asthma or chronic bronchitis.
So inflammation in the airways, maybe.
Possibly playing a role, yeah. And interestingly, having a collapsed part of the lung already that's atelectasis or having fluid already present in the chest, pleural effusion, those seem to predispose an animal to torsion.
So existing problems can make it more likely.
Exactly. We also know that recent surgery on the chest or the diaphragm is a definite risk factor.
Makes sense.
But then there are cases, especially like with the pugs, where it just seems to happen out of the blue, spontaneous. Or we just can't find any underlying reason. That's when we call it idiopathic.
Idiopathic, meaning cause unknown.
Right.
So it can be a bit mysterious. When a vet does suspect this, given all those symptoms could point elsewhere, how do they actually confirm it's lung lobe torsion?
Yeah, you're absolutely right. The differential diagnosis list is pretty long. Vets have to consider lung lobe torsion alongside, a lot of things.
Like what?
Like bruising on the lungs from trauma, simple lung collapse, a diaphragmatic hernia where organs slip into the chest,
Oh, wow.
lung abscesses, other kinds of lung tissue death, cancer, weird inflammatory conditions, even problems with blood clotting, pneumonia, blood clots traveling to the lungs,
So many possibilities.
congestive heart failure, just fluid buildup for other reasons, fungal infections, reactions to maybe inhaling something, a foreign body blocking an airway. It's a real process of elimination sometimes.
A medical detective case, like you said. So what tests help narrow it down beyond the physical exam?
Lab work is usually the first step. CBC, chemistry panel, urinalysis. These often show high neutrophils, a type of white blood cell indicating inflammation or infection, and often anemia, low red blood cells.
Right.
One interesting point from the text, if the neutrophils are actually low, so neutropenia, that might suggest a poorer prognosis, unfortunately. And if there is fluid in the chest, sampling and analyzing that fluid is crucial.
Thoracentesis.
Exactly, thoracentesis. Initially, that fluid is often bloody, hemorrhagic. But if it's been going on longer, or if there was already fluid for another reason, it might look different. Maybe what's called a modified transudate or even chylus, that milky lymphatic fluid again.
Right. And imaging. I assume x-rays are pretty key here.
Oh, absolutely.
Yep.
Chest radiographs, x-rays are fundamental. With torsion, the affected lobe usually looks opaque, like solid white or gray on the x-ray. You lose the normal pattern of blood vessels inside it. And the airway, the bronchus, leading into that lobe might look like it just stops abruptly or is cut off or pointing the wrong way.
Makes sense if it's twisted.
Exactly. Early on, you might still see some air in the smaller airways within the lobe, air bronchograms, but the main bronchus looks wrong.
Yeah.
Sometimes you get this weird sponge appearance inside the lobe from trapped gas bubbles.
Huh, a sponge appearance.
Yeah, it's quite characteristic when you see it. And then there's the pleural effusion, the fluid, which shows up usually layering down at the bottom of the chest on the x-ray, obscuring things.
Right.
The twisted lobe itself might look swollen, consolidated, and sometimes it's big enough or twisted enough to push the heart or the trachea, the windpipe, out of position.
Wow.
You might even see the whole central part of the chest, the mediastinum, shift over to one side or the other.
So the x-rays can show a lot. You mentioned draining the fluid helps.
Yes, definitely. Doing that thoracentesis we talked about, pulling off some of that fluid can make a huge difference in being able to actually see the abnormal lobe and the position of other structures on a follow-up x-ray. It clarifies the picture.
Makes sense. Are there other imaging tools besides x-rays?
Yes. Ultrasound can be useful, especially before you drain the fluid. It can sometimes give a better look at the texture inside the lobe. You might see a darker edge and brighter speckles inside. Maybe the lobe edges look rounded instead of sharp.
Okay.
And then there's computed tomography, CT scans. These give amazing detail, really helpful for surgical planning. But the downside is the animal needs full anesthesia, and you have to control their breathing during the scan.
Right, so more involved.
Hmm.
Any other procedures used for diagnosis?
Well, we mentioned thoracentesis for fluid analysis. Another option is bronchoscopy, putting a tiny camera down the airways.
Ah, to look directly.
Yeah, sometimes you can actually visualize the twisted or blocked bronchus. But often, the most definitive way to both diagnose and treat is surgical exploration, opening the chest to see exactly what's going on.
Okay, so that leads us to treatment. If it's lung lobe torsion, what's the plan?
First things first, stabilize the patient. Supportive care is critical. That means oxygen therapy, definitely. Maybe draining the chest fluid with thoracentesis, or even placing a chest tube for ongoing drainage if there's a lot of fluid.
Right.
Intravenous fluids are usually needed for hydration, blood pressure support, and if they're in shock, treating the shock is paramount.
Okay, stabilize first, then what?
Then, the definitive treatment, and this is really the main point. Surgical removal of the twisted lobe lobectomy is the only truly effective treatment.
Just remove it completely. No trying to untwist it.
No, definitely not. Trying to untwist it is really risky. It might just twist again later. Plus, when you untwist it, all the toxins and inflammatory stuff that built up in that damaged tissue can suddenly flood back into the bloodstream.
Oh, like reperfusion injury.
Exactly. That can cause severe systemic problems like acidosis. So, standard practice is to tie off or clamp the blood vessels supplying the lobe before removing it to prevent that rush of bad stuff. Surgeons often use special surgical staplers now to make this safer and quicker.
Got it. Clamp, then remove.
Yep. And during the surgery, it's crucial to have a good look around the rest of the chest, make sure nothing else is wrong. And the removed lobe should always be sent off for analysis, culture, pathology.
Okay, so surgery is the fix. What about recovery? What happens after the operation?
Post-op care involves really close monitoring, continuing supportive care as needed, managing any chest tubes, making sure they're breathing okay. And you do have to keep in mind, although it's rare, it is possible for a different lobe to twist later on.
Oh, really? Even after one is removed?
It's uncommon, but yes, something to be aware of. Medication-wise, they'll typically get antibiotics around the surgery time to prevent infection, shock treatment if needed, and of course, good pain control is essential.
Makes sense. Pain management is key.
Absolutely. The source material didn't really mention any specific reasons not to do the surgery or major drug conflicts unique to this condition.
Okay. And then long term, after they go home, what should owners watch for?
Well, definitely watch for any signs of breathing difficulty returning or fluid seeming to build up again. One potential complication, mostly seen in cats but possible in dogs, is something called re-expansion pulmonary edema.
Re-expansion pulmonary edema. What's that?
It can happen if a lung that's been collapsed for a long time, maybe by fluid, gets reinflated too quickly, either by draining the fluid fast or during surgery. It causes fluid to build up inside the lung tissue itself. It's serious if it happens.
Okay, so careful reinflation is important.
Very. Follow-up chest x-rays are usually done before they leave the hospital and maybe again later if needed, just to make sure everything looks okay. But overall, the prognosis, the outlook, it's generally considered fair to good if the surgery goes well and there isn't some other major underlying problem still present.
That's good to hear. Fair to good is hopeful. So, wrapping this up, what's the absolute key takeaway for everyone listening about lung lobe torsion?
I think the most crucial thing is that this is a serious, potentially fatal emergency. Recognizing the signs, especially difficulty breathing, and getting veterinary help fast is critical. Surgery is the treatment, and it needs to happen promptly for the best outcome.
Right. So vigilance is key, especially, if you have one of those breeds we talked about, the deep-chested ones or a pug. Knowing the signs is power, really.
Absolutely. It's something you hope you never encounter, but being aware means you can act quickly if you do.
Definitely. It really highlights how important it is to be observant of our pets and to have that relationship with your vet for regular checkups, too. Makes you wonder what else might be going on inside them that we don't see.
It really does. These complex little bodies, or big bodies, depending.
Yeah. So thinking about that complexity, given how intricate animal anatomy is, what other unexpected twists or turns, maybe literally or figuratively, could their bodies take? And how can we, as people who love and care for them, best prepare ourselves for those unknowns?
That's a great question to ponder. It really speaks to continuous learning, doesn't it? Staying informed, asking questions, and just being really tuned in to our animal companions.